My name is Kara Cleveland, and I'm the supervisor of the Indiana State Library's Professional Development Office. I will be the host and question moderator for today's webinar, KEPRO, Free Medicare Services and Resources for Seniors, presented by Andrea Plaskett, who is an outreach specialist for KEPRO. I need to go over a few housekeeping items before we start. If you're having sound issues during the webinar, please see the sound issues box just below the chat box. If there is a global sound issue, we will announce it in the chat box. If you are unable to resolve the sound issue you are experiencing, we are recording the webinar and you can watch it offline after it has ended. Again, if there is a global sound issue, we will make an announcement in this chat box in the lower left-hand corner. Also, if you have a question, just type it in the chat box on the upper left side of the screen. I'll be watching and will get your question to Andrea as soon as there's a good opportunity. There should also be time near the end of the presentation for questions. The session today is worth 1 LEU, and your certificate will be available for download at the end of the webinar. Also, today's webinar will be recorded and archived. After the webinar has been transcribed, it will be available on the Indiana State Library's archived webinars page. For weekly updates on upcoming trainings and to learn more about what's happening in libraries across the state, please subscribe to the Indiana State Library's e-newsletter called the Wednesday Word, and check our continuing education website for other professional development opportunities. And now I am happy to turn the presentation over to Andrea.
Great, thank you, Kara. I hope everybody can hear me okay. As Kara said, my name is Andrea Plaskett, and I'm an outreach specialist with KEPRO for the state of Indiana. Before we get started, I did want to send a special thank you to Kara for working with me to coordinate this event for you all this morning. To learn more about KEPRO's free services for Medicare beneficiaries and how libraries can help inform the residents in your own communities about these free services. I'd also like to point out, since today's webinar is being recorded for future viewing, that the information I'll be covering is conditionally effective through May of 2019. So it is subject to change at any time during this contract period. So for the most up-to-date information, you can either visit our website, keproqio.com, which I'll talk more about later on, or you can contact me directly as well for the latest information and resources. So in today's presentation, I'll be giving a general overview of what KEPRO does. And I do want to preface this with that I understand that some of the level of detail that I'll be going over with you all obviously does not directly pertain to the work that you do. But I think by going through our processes with you all, I think it'll really help you better understand our role and what we can do to help the seniors in your community. And then of course I have some resources at the end that I'll go over with you that you can use to help educate your patrons about their Medicare rights and our available free services. So first I'll start off with a little bit of background on who KEPRO is. And we are known as a beneficiary and family-centered care quality improvement organization, or a BFCCQIO. And we are contracted through the Centers for Medicare and Medicaid Services and provide case review services and manage beneficiary complaints and appeals across certain areas. And those areas are highlighted there on the map for you. So you can see that Indiana falls under KEPRO's Area 4, which simply means that you need to call the Area 4 helpline number for assistance. Of course, all of our services are the same across our areas and are available free of charge to Medicare beneficiaries, as well as their caregivers, family members, or representatives. And then the northeastern and western states of the country that aren't covered by KEPRO are covered by another BFCC QIO, Livanta, and they provide the same services. And our free services include discharge appeals and service terminations, beneficiary complaints, immediate advocacy, and patient navigation. And I'll go into more detail about each of these, starting with the appeals process, which the appeals process makes up a very large portion of the work that KEPRO does. So discharge from a hospital and service terminations in post-acute settings can be appealed if the beneficiary does not feel ready enough to leave. And in both those settings, beneficiaries will be provided with various forms during their stay, as you can see there on the slide. So, for example, in the acute care setting in a hospital, prior to being discharged, providers are required to give inpatients the important message from Medicare. And this form describes the beneficiary's right to appeal that discharge and then the steps in the appeals process. It also includes information on when to contact KEPRO and then the helpline number for them or their representative to call. Beneficiaries might also be provided with those other forms listed there, and information about their appeal rights are also included on those forms as well. Now in the post-acute setting, which would include skilled nursing facilities, home health, outpatient rehab, and hospice, patients will be provided with the notice of Medicare non-coverage prior to all of their services being terminated. And again, this notice also describes the patient's right to appeal and instructions on how to contact KEPRO to request that appeal. So the appeals process would begin when the provider issues that notice to the Medicare beneficiary with information about their right to appeal the discharge. Then to actually initiate the process, the beneficiary or the representative would call into KEPRO's helpline and request that appeal. Once we receive that request, we will then contact the provider and request a copy of the medical record. And then once we receive all of that documentation, the record will be reviewed by one of our physicians. And then once they make a decision, both the beneficiary and provider will be notified of our determination. Now, during an appeal, there are a few factors to keep in mind, like financial liability that's associated with the care while an appeal is being processed, or the time frame for the appeal to be completed in. But generally speaking, for skilled service appeals, the whole process should be completed by the date that's on the notice of Medicare non-coverage that the beneficiary received. And then for hospital appeals, usually within 2 days after the request is made. Now, both those time frames, those are for timely requests. And the deadline to submit a timely appeal will be spelled out in those notices that the beneficiary receives. And as long as they make that appeal within that time frame, they will be financially protected during the process. Now keep in mind though, hospital discharge appeals are for inpatients only. So we don't process appeals for patients who are in observation status. Patients should know if they're in observation status if they receive the MOON notice or the Medicare outpatient observation notice that informs them that they are actually in observation. And then the link there on the slide, that will take you to CMS's webpage where you can download any and all of those notices that I went over with you that the beneficiary could receive. And then once an appeal is actually filed, both the beneficiary and provider can go on our website to check on where the case is in the process. And that's done by clicking on our Check Case Status button on our homepage, and it's circled there in red on the slide. And then once you click on that, you would just enter your case number. This feature also includes information on if and when financial liability will begin. And this is actually one of our most used features on our website. And this slide is just an example of a case that was brought to us for an appeal. So I'll read this to you. I live in another city, but when my grandmother fell and broke her hip, I got some time off work to visit her. She can barely get out of bed to walk. Now the hospital says they are discharging her, and I have to go back home. She lives alone, and I don't think she's ready to be discharged. So upon receiving this call, our KEPRO intake specialist would then follow the steps that I just went over with you. Okay, now on to our beneficiary or quality of care complaints, which are for Medicare covered services that have been received within the last 3 years. And complaints can include things like a wrong diagnosis, receiving the wrong type of treatment, or maybe receiving inadequate discharge instructions. Some other important aspects about this process, if an individual has a quality of care concern, they must complete a CMS form, and this form must be filed by either the beneficiary or their representative. It's also important to note that the findings of a complaint are not admissible in a lawsuit. This information is protected and is not used against facilities or providers. Now, if something were to show up during our review that care did not meet certain standards, the case would then be referred on to the appropriate entity for a quality improvement plan or some sort of activity to address the issue that we found. So here's an overview of the process for our quality of care complaints. And as you can see, it begins with the filing of the complaint by the beneficiary or their representative, and that can be done by phone, email, or mail. And again, this is for services that have been received under Medicare within the last 3 years. So in order to proceed with the process, the CMS form that I mentioned in the last slide, that must be filled out and signed by the beneficiary or their representative and sent back to us. Once the forms are completed, a nurse will then contact the beneficiary to discuss their concerns and then to gather any additional information that might be useful for the case. From there, a request for the medical record will be made, and our nurse will prepare the case for the physician reviewer. Then, based on that review, a determination will be made as to whether the beneficiary receives the appropriate care. And a letter with that determination will be sent to the beneficiary or their representative, now with an opportunity for a reconsideration, where they can request a second review if they disagree with the findings of our first review. And again, if KEPRO does find that care did not meet certain standards, the case will then be referred on to another agency to implement a quality improvement plan to address the issue with the provider. And that can be in the form of education, training, or maybe an improvement plan or project. And here's an example of a situation that was brought to KEPRO with a beneficiary complaint. So this says, my wife has dementia and is using a wheelchair after being hospitalized with pneumonia. She is very weak and is taking several medications that affect her walking and standing. They said she fell over in her wheelchair and hit her head. I think they should have had someone watching her or done something to prevent her fall, but they didn't seem concerned. So again, the steps that I just went over would then be followed with this complaint. Okay, our next service is immediate advocacy, and to provide you with just a quick overview, it's an informal process that we use to resolve a complaint quickly. And it begins when the beneficiary or their representative gives us their consent to proceed with the complaint. And once we get that consent, we can then contact the provider or practitioner on their behalf. And as you'll see, because I'll go over a couple of examples with you in the next few slides, this is more for immediate concerns, as it says in the title, immediate advocacy, and more so for concerns that might not be documented in a medical record. So as I said, I'll be going over a couple of examples of success stories with you where immediate advocacy was used to highlight the ways that this process can help resolve beneficiary concerns more quickly than beneficiary complaints can. So in this example, the mother of a beneficiary contacted KEPRO with concerns that her son's care at the hospital, with concerns about her son's care at the hospital and then what his care would look like after his discharge. She was overwhelmed and anxious because he had a very poor prognosis and would need very intensive care upon his discharge. So from there, she requested KEPRO to intervene. And after speaking to one of our intake specialists, they then contacted the QIO liaison at the facility that her son was in, and the facility actually acknowledged and agreed with the mother's concerns, and then took action to find placement for her son in a facility after discharge, rather than sending him home for his mother to care for him. So the takeaway with this one is that immediate advocacy can be very beneficial to help in situations where, as I said, a formal case review isn't required, but the beneficiary or their caregiver in this instance still had a question or concern about their care. Now, many times immediate advocacy can help with matters that might relate back to communication issues or misunderstandings between providers and beneficiaries, or maybe even between beneficiaries and their insurance plan. And KEPRO can help to bridge that gap, or at least help facilitate a more meaningful conversation between the two sides. So in this example here, the beneficiary had issues with his insurance plan not providing coverage for an eye exam that was needed. So KEPRO arranged for a conference call between the beneficiary and the insurance provider's representative to help resolve the issue and find a provider that was covered under their plan. Okay, and then finally, I wanted to talk a little bit about the services that we have that are under our Person and Family Engagement Initiative, or PFE initiative for short. Now, in general, person and family engagement is about being a part of a collaborative partnership between you and your healthcare provider. And the intent behind KEPRO's initiative is to help reduce hospital readmissions, improve care transitions, and make care safer for our Medicare beneficiaries. And KEPRO plans to do that by educating and engaging beneficiaries as well as our partners on the QIO process and our different programs like immediate advocacy, which I just went over with you, and our newer patient navigation program, which both fall under this umbrella of person and family engagement. And we're doing this so that everyone has a better understanding of our role and then what we can do to help them and their families. Okay, so again, as I said, immediate advocacy and patient navigation are the services that fall under this person and family engagement initiative. We already touched on immediate advocacy. Patient navigation, as I said, is a newer program of ours, and that can help beneficiaries better coordinate their care and find local resources. And I'll go into more detail on this shortly. And then additionally, with this initiative, KEPRO is also helping beneficiaries and their families by better clarifying the review process. So as beneficiaries are filing appeals or submitting complaints to us, during those processes that I just went over with you, we're trying to find extra time to make sure that the beneficiary understands the process and what's going on and what they might need to do next. And if we find that they need some additional assistance, we'll then internally refer them to the immediate advocacy or patient navigation programs. Now, with the new patient navigation program, Medicare beneficiaries will have a one-to-one relationship with our patient navigators who can assist beneficiaries by helping them navigate through the often confusing and complex healthcare system, help them coordinate their care or arrange appointments. They can assist with helping them manage medications and also provide them with education on their particular diagnosis or treatment plan, and also educate them on ways to stay healthy and prevent further disease. And then also help with finding local resources and information so that they can stay safe and healthy at home. And then here is an example of what this navigation process could look like. So here a Medicare beneficiary was hospitalized with a collapsed lung, weakness, and weight loss issues. The beneficiary's daughter filed an appeal as she felt her mother was not ready for discharge, but the appeal was not found in her favor. So from there, she requested her mother be placed in our patient navigation program. Now, per the daughter, the beneficiary was compliant with all of her prescribed medications, had no mental health issues, and her daughter was her main support system. The patient navigator was able to assist the daughter in contacting her local agency for older adults, and was also able to set up a medical alert since the beneficiary lived alone, and put Meals on Wheels in place due to her weight loss issues. Now, because of the help through KEPRO's patient navigation program, the beneficiary was able to remain in her home with the assistance of the Agency for Older Adults and the medical alert. She did not need to return to the hospital or emergency room while in our program, and then was discharged from the program after 35 days. The daughter did express gratitude for the added assistance. Now, it's important to note that the beneficiary was in the program for only 35 days. And on average, the length of time for the program is between 30 to 60 days, of course, depending on the individual needs of that beneficiary. And that's because an important part of this program and vision of this initiative is really recognizing and promoting those community resources that are already available and promote wellness in the community to help keep beneficiaries safe and healthy at home and hopefully not readmit to the hospital or emergency room. So now I want to talk about how beneficiaries can become enrolled in the navigation program and the resources that we have for you to utilize in your own work and outreach in the community. So this is a screenshot of our patient navigation webpage. There's the direct link there at the top of the slide that will take you right to this page. So for this service, the patient navigation program, you can either direct beneficiaries to call the Area 4 helpline number, as you would for all of our other services, or you can go to this web page and there's a form that they can fill out with their contact information. And one of our navigators will follow back up with them within one business day and talk more about the program and see if they would be a good fit. And then here is a screenshot of our person and family engagement webpage. There's the link, the direct link there at the top of the slide. And here is where you can get more information on immediate advocacy and then patient navigation as well. So if you click on the patient navigation link on this page, it will take you back to that web page that I previously just showed you. Now, also on this page are resource centers for both providers as well as for beneficiaries and their families. And the Beneficiaries and Families Resource Center has a lot of good tools to help beneficiaries when they visit their doctor, what types of questions to ask, how to manage their medications, how to be an advocate for themselves in their own health care. So good tools like that are helpful for both beneficiaries and their family members or caregivers. And then these are our operating hours. Beneficiaries, providers, and stakeholders like you can use our toll-free helpline numbers to contact us. And again, yours would be Area 4. And our representatives are available 9 to 5 weekdays and 11 to 3 weekends and holidays. Now, voicemails can also be left 24 hours a day, 7 days a week, and the call will be returned by the end of the next business day. And then also translation services are also available. And this slide just summarizes those 4 services that I went over with you that again are free of charge for Medicare beneficiaries and their family members. And then the link to our homepage, KEPROQIO.com. That has a lot of other resources and information that you might find helpful that I didn't get to touch on today, but I would suggest looking around on the website. It has, as I said, a wealth of information. And then this is just a quick survey if you have time afterward to let me know how I did. We would really appreciate your feedback. to make sure that we're providing our stakeholders with the information and resources that you need. And then before I go on to questions, I did want to show you a couple of resources that have been included with the presentation. Great, thank you, Kara. Okay, perfect. So this is a library toolkit that we developed as we began that person and family engagement initiative that I talked about a little bit ago. And the reason that we're reaching out to the local libraries is that, you know, as I'm sure you're aware, that's a place that a lot of Medicare beneficiaries and seniors might go to for help on a variety of topics. So since you're kind of, you know, possibly one of the first lines of defense, so to speak, we thought it would be good for you guys to have this information and resources to share with your patrons in your community. So just going through this briefly. Oh, okay, I made it bigger. Oops. Oh, sorry. Okay, so it gives you a quick introduction on who KEPRO is. You can click on the KEPRO link there, and that will take you right to our homepage. And then the 4 services are outlined next that I went over with you in the presentation to help refresh your memory, or for those who couldn't attend today, you can learn more about what we do. And then lastly, the links here for the resources that you can share. So this first one is a poster, and if you click on it, it will take you to our web page, and all you would need to do is scroll down just a bit and then click on the Area 4 poster, and that'll bring up a poster titled Medicare Rights, or Know Your Medicare Rights. I'm not quite sure what it says. And it lists all of the services that I just went over with you, and then it has the helpline number for beneficiaries to call. Next is a newsletter insert that you can share in your community newsletters or bulletins or communications or wherever you think it might be appropriate. We also have an informational video for seniors in your community. It's about 15 minutes long, and it goes through the services that I just went over with you and the helpline numbers to call. It is directed toward the beneficiary, so you know, you can schedule some time in an activity calendar to play the video or to share the link with your patrons that way. Next is our public service announcement. So with this one, you would just need to scroll down on the page a bit, and you can download our MP3 file of a PSA for Area 4. You can give that to your local radio stations or media outlets if you're involved with them. And then we also have a press release that you can share as well. And then I have one other poster for you. Okay, so this is our, perfect. So this is our poster that's specific to that newer program that I talked about, our patient navigation program. So this goes into a little bit more detail on that specific program and what it offers. Again, it has the helpline number to call. And then on this flyer, it has the direct extension to reach the navigation department. So you won't have to, you know, talk with an intake specialist and be directed from there. You can call the department directly. And with this flyer and that first poster that I talked about, that'll have that says your Medicare rights. Those are great to post on bulletin boards or to have out with other resources in your communities. So those two, I think, are great to share with the beneficiaries that visit your library as well. So And then I believe Kara has my contact information, and I'm sure these resources will be available for download after the webinar. Is that correct?
That is correct. Yes, we are recording this webinar and it will be on our archived webinar training page after it's been transcribed. But everyone that registered for the webinar today, you will get a link that probably in your email tomorrow that you can access. And if there's any other questions, you can contact me here at the Indiana State Library or Andrea. So I will include her information in that email as well.
Perfect. Thank you, Kara. And if you know of others who weren't able to join today, please feel free to share the toolkit among your colleagues as well.
Okay, at this point, if anybody has any questions, you can type them in the chat box on the left top-hand corner. I'm also going to go ahead and bring up the link for the LEU for this. At the top, we have the different documents for download, the ones that Andrea just talked about and showed you. So you have those, the outreach toolkit, also the flyer, as well as our certificate. So you can download those. Also, Andrea, can you type your contact information in the bottom box?
Oh, sure, where it has my name already?
Yes.
Yes, okay.
While Andrea is doing that, I just want to thank all of you that were able to attend today and encourage you to share this information, like Andrea said, with your colleagues as well as with your patrons.